Atropine. Atropine is a tropan-alkaloid and anticholinergic medication used to treat certain types of nerve agent and pesticide poisonings as well as some types of slow heart rate, and to decrease saliva production during surgery. Adrenaline. Adrenaline, also known as epinephrine, is a hormone and medication which is involved in regulating visceral functions. Adrenaline is normally produced both by the adrenal glands and by a small number of neurons in the medulla oblongata. Norepinephrine. Norepinephrine, also called noradrenaline or noradrenaline, is an organic chemical in the catecholamine family that functions in the brain and body as both a hormone and neurotransmitter. As a neurotransmitter in your brain and spinal cord, norepinephrine increases alertness, arousal, and attention. Constricts blood vessels, which helps maintain blood pressure in times of stress. Dopamine. Dopamine is a type of neurotransmitter and hormone. It plays a role in many important body functions, including movement, memory, and pleasurable reward and motivation. High or low levels of dopamine are associated with several mental health and neurological diseases. Dobutamine. Dobutamine is a medication used in the treatment of cardiogenic shock and severe heart failure. It may also be used in certain types of cardiac stress tests. It is given by IV only, as an injection into a vein or intraosseous as a continuous infusion. Chlorpheniramine. Chlorpheniramine relieves red, itchy, watery eyes, sneezing, itchy nose or throat, and runny nose caused by allergies, hay fever, and the common cold. Chlorpheniramine helps control the symptoms of cold or allergies but will not treat the cause of the symptoms or speed recovery. Promethazine. Promethazine is a first-generation antihistamine and antiemetic used to treat allergies, insomnia, and nausea. It may also help with some symptoms associated with the common cold and may also be used for sedating people who are agitated or anxious. Vasopressin. Vasopressin is known to regulate blood pressure, blood osmolality, and blood volume. The effects of V1A and V2 receptors can be amplified when vasopressin is secreted in excessive amounts, and this condition may be experienced by patients undergoing a disease or stress. Durafilin. Durafilin tablet is used to treat asthma and chronic obstructive pulmonary disorder, a lung disorder in which the flow of air to the lungs is blocked. It helps in relaxing the muscles of the air passages and making it easier to breathe. Aminophylline. Aminophylline belongs to a group of medicines known as bronchodilators. Bronchodilators are medicines that relax the muscles in the bronchial tubes, air passages, of the lungs. They relieve cough, wheezing, shortness of breath, and troubled breathing by increasing the flow of air through the bronchial tubes. Furosemide. Furosemide is a loop diuretic medication used to treat fluid buildup due to heart failure, liver scarring, or kidney disease. It may also be used for the treatment of high blood pressure. It can be taken by injection into a vein or by mouth. Mannitol. Mannitol is an osmotic diuretic that is metabolically inert in humans and occurs naturally, as a sugar or sugar alcohol, in fruits and vegetables. Mannitol elevates blood plasma osmolality, resulting in enhanced flow of water from tissues, including the brain and cerebrospinal fluid, into interstitial fluid and plasma. Sodium bicarbonate. Sodium bicarbonate, also known as baking soda, is used to relieve heartburn, sour stomach, or acid indigestion by neutralizing excess stomach acid. When used for this purpose, it is said to belong to the group of medicines called antacids. It may be used to treat the symptoms of stomach or duodenal ulcers. Hydrocortisone. Hydrocortisone is the name for the hormone cortisol when supplied as a medication. Uses include conditions such as adrenocortical insufficiency, adrenogenital syndrome, high blood calcium, thyroiditis, rheumatoid arthritis, dermatitis, asthma, and COPD. It is the treatment of choice for adrenocortical insufficiency. Dexamethasone. Dexamethasone is a glucocorticoid medication used to treat rheumatic problems, a number of skin diseases, severe allergies, asthma, chronic obstructive lung disease, croup, brain swelling, eye pain following eye surgery, superior vena cava syndrome, and along with antibiotics in tuberculosis. Mephentermin. Mephentermin is a cardiac stimulant. It was formerly used in Wyamine nasal decongestant inhalers. It has been used as a treatment for low blood pressure. Mephentermin belongs to the class of adrenergic and dopaminergic cardiac stimulants excluding glycosides. Used in the treatment of heart failure. Esmolol. Esmolol, sold under the brand name Breviblock, is a cardioselective beta receptor blocker with rapid onset, a very short duration of action, and no significant intrinsic sympathomimetic or membrane stabilizing activity at therapeutic dosages. It is a class 2 antiarrhythmic. Labetalol. Labetalol is used to treat high blood pressure. Labetalol is in a class of medications called beta blockers. It works by relaxing blood vessels and slowing heart rate to improve blood flow and decrease blood pressure. Verapamil. Verapamil is in a class of medications called calcium channel blockers. It works by relaxing the blood vessels so the heart does not have to pump as hard. It also increases the supply of blood and oxygen to the heart and slows electrical activity in the heart to control the heart rate. Amiodarone. Amiodarone is an antiarrhythmic medication used to treat and prevent a number of types of cardiac dysrhythmias. This includes ventricular tachycardia, ventricular fibrillation, and wide complex tachycardia, as well as atrial fibrillation and paroxysmal supraventricular tachycardia. Lidocaine. Lidocaine, also known as lignocaine and sold under the brand name Xylocaine among others, is a local anesthetic of the aminoamide type. It is also used to treat ventricular tachycardia. Lidocaine cream topical local anesthetics. Lidocaine belongs to the family of medicines called local anesthetics. This medicine prevents pain by blocking the signals at the nerve endings in the skin. This medicine does not cause unconsciousness as general anesthetics do when used for surgery. Diazepam. Diazepam, first marketed as Valium, is a medicine of the benzodiazepine family that acts as an anxiolytic. It is commonly used to treat a range of conditions, including anxiety, seizures, alcohol withdrawal syndrome, muscle spasms, insomnia, and restless leg syndrome. Lorazepam. Lorazepam, sold under the brand name Ativan among others, is a benzodiazepine medication. It is used to treat anxiety disorders, trouble sleeping, severe agitation, active seizures including status epilepticus, alcohol withdrawal, and chemotherapy-induced nausea and vomiting. Sodium nitroprusside. Sodium nitroprusside, sold under the brand name Nitropress among others, is a medication used to lower blood pressure. This may be done if the blood pressure is very high and resulting in symptoms, in certain types of heart failure, and during surgery to decrease bleeding. Nitroglycerin. Nitroglycerin is a vasodilatory drug used primarily to provide relief from anginal chest pain. It is currently FDA approved for the acute relief of an attack or acute prophylaxis of angina pectoris secondary to coronary artery disease. Antifibrinolytic agents. Antifibrinolytic agents may be used to help prevent or treat serious bleeding in patients who have certain conditions, such as hemophilia, very heavy menstrual bleeding, or some types of vascular tumors. They may also be used to help prevent or control bleeding during or after surgery or after a traumatic injury. Styptic. A styptic, also spelled styptic, is a specific type of anti-hemorrhagic agent that works by contracting tissue to seal injured blood vessels.